lockdown for 3 weeks enforced by the police, Johnson declares a national emergency in an historic address to the nation.
From this evening, I must give the British people a very simple instruction. You must stay at home. If too many people become seriously unwell at one time, the NHS will be unable to handle it.
It means all this stops tonight. Only shopping for essentials and medicine. Only one form of exercise a day. No public gatherings of more than 2. Only travelling to work if unavoidable. The reason is stark.
I decided to make a coronavirus documentary given how it has changed our lives over the last year. During lockdown, I interviewed a healthcare professional who worked on COVID wards and intensive care units in one of the busiest hospitals in the country. She spoke to me about her experiences working in the hospital and her role in looking after patients with coronavirus.
My name's Halima Ashraf. I'm a physician associate in general practice in London. And my role is to basically triage patients in primary care, so in your GP, and then kind of make diagnoses, take histories from patients, and treat them and manage their conditions. Coronavirus, it's actually a large family of viruses. So it's not just one type of virus, it's quite a large family of viruses. But the one that's responsible for this pandemic is called SARS-CoV-2. And that's the one that's been predominantly responsible for the pandemic that we're going through, and the virus that's caused. And that's actually the virus that we call COVID-19. And it started, the first case was found in Wuhan in China in December 2019. Which is why it's called COVID-19. And I think our first case in the UK was in February last year. So around this time last year, we had our first few cases in the UK. That's what coronavirus is. It tends to be a virus, a respiratory virus. So it affects you like a cold would, like the common cold or the flu would. It gives you those types of symptoms. But it can be quite fatal, which is why it's causing a lot of deaths in the UK and around the world. And it's causing a lot of people to need help with their breathing, which is why we have a lot of patients in intensive care units, things like that. So, yeah. So my role during the pandemic, when it first hit, I was actually a student. Physician associate, so I was on placement in the hospitals in London. So I was actually just on placement when it first hit on the acute medicine wards, and then when it actually hit and universities closed and we weren't allowed to be in hospitals anymore because it was unsafe, it was getting quite unsafe in the hospitals, due to like lack of PPE. They didn't know what we were doing with the wards and things like that, so they classed it as really unsafe for students to be there. So universities shut, placements were cancelled, and then after that, I went to St George's University. So that trust, they asked for students to kind of help be healthcare assistants, really. So we'd get paid for the job, but as we weren't doing anything to do with our uni anyway, lectures were cancelled, things like that. I decided to apply for the job of being a healthcare assistant and helping during the pandemic. So I got the job, didn't really need an interview or anything. They just took the fact that we had all the basic skills from uni, and then I was popped straight into COVID intensive care units to be a healthcare assistant. So that role involved kind of working with the nurses, with patients who were on ventilators, so none of them were awake. They were alive, but they weren't awake. They were in comas. So we had to look after those patients and to help take their bloods, manage their observations, so check their blood pressures, check their heart rate, pulse rate, check their oxygen levels, kind of make sure that everything was okay. The other thing that I helped with was washing and cleaning of the patients and changing their bed sheets. That all needed to be done daily. So patients were washed every single day, they were changed every single day, and their bed sheets were all changed every single day too. So we'd help with that. The other thing is that we'd be something called a runner. So we had COVID red zone and COVID green zone. So the red zone was where you're exposed more to COVID, and the green zone was you're okay in the vicinity that you are in. So sometimes I was in the green zone and I would help give nurses in the red zone the medications from the fridge and things like that, and run to get syringes and anything else that they needed. So a lot of my role was just helping with the nursing staff and assisting them with the patients. So it's quite good. I had very good exposure, but again, we were all at risk of getting COVID. So we were all in full PPE. I had a full surgical gown on at all times, or a hazmat suit, which was really, really warm. I had to wear my full, really protective mask at all times, unless I was leaving the unit. So, and as well as goggles or a face shield, so a visor, and a scrub cap as well to kind of protect your hair, and gloves obviously. And then on top of the scrub gowns, we'd also wear aprons on top of that as well for extra protection. And all of this was over our scrubs, obviously, like this. So we'd all wear scrubs at all times. You'd never wear your normal clothes. And we'd often be in those suits for about 10, 12 hours straight, up until we have our breaks, or our lunch and things like that, or we wanted to change our mask. So yeah, it was quite difficult. That was my main role during the pandemic. So that was from March till September. After that, I fully qualified as a physician associate, finished uni, and since October till now, I've been in GP as a physician associate. So as I said before, just triaging patients who call up on the same day for an emergency appointment or to discuss anything else. I triage them on the phone, take a history, figure out a management plan and treat their issues. I still see patients face to face if I need to see them, and then we go from there. So those have been my 3 roles through the pandemic: a student, a healthcare assistant, and a physician associate. So the corridors themselves, they weren't busy because usually hospital corridors are full. There's usually patients walking around, students walking around, clinicians, all the workers are walking around, and there's also visitors in the hospital. So usually hospitals are very, very busy. But the corridors and things during the pandemic were completely empty. It was like a ghost town. There was no one walking around. You'd often be walking in the corridor by yourself. So yeah, the corridors were not busy at all. However, the wards were very busy. So like I said, I was in the intensive care units. Every single bed was full. And I worked in one particular intensive care unit where they had a surgical unit as well next to it. So they were using surgical theatres where patients usually go for surgery. They were using them as intensive care areas as well. So they had about 2 patients in each theatre, with nurses looking after them and healthcare assistants looking after them, because there weren't any space left. There wasn't any space left in the wards. So the wards themselves were very, very busy. Normal wards, I'm not too sure because I was never on a normal ward until about later on, like July, August. Then I was on a bit of a normal ward then.
Whilst working with patients who tested positive for coronavirus, Halima herself had symptoms and had to self-isolate.
I knew I'd get it eventually because I was in contact with so many positive patients and I wasn't wearing PPE. So when I was on placement as a student on the ward that I was working in, we had about 2 or 3 positive patients who at the time weren't isolating in a room because the rules weren't there for that. So they were just on an open ward. We were still going to do ward round on them. I took bloods from these patients as well. And when their tests all came back positive, I knew that, there's a high chance that I'm going to get it now, because I've been in contact with this patient where I wasn't wearing a mask, I wasn't wearing any PPE. I wore gloves to take the bloods, but that's about it. So I knew that I was going to get coronavirus from then. But the rules were completely different last March. You only self-isolated when you got symptoms. You were only allowed to get tested if you were in hospital, actually. And the only people who were allowed to do the tests were the infectious disease doctors. So I wasn't self-isolating because the rules weren't there to self-isolate. It was self-isolate when you have a symptom, and I didn't have a symptom. I just knew that I was in contact with a positive patient. So I just went about my days as would anyone at that point. And then about 5 days later, I started to get a cough. So I started to get a cough. I had a fever, so I was feeling really hot and cold. That's when I then self-isolated. So I was on a Monday. I didn't get a test because I wasn't allowed to get a test. I called 111, and they said the only people who we're giving tests to right now are those in hospital. No one else is allowed to get tested. So I was like, okay, that's fine. I'll just have to self-isolate. So I self-isolated. And then about 3 or 4 days into my symptoms, I lost my sense of taste and smell completely. Couldn't smell anything, couldn't taste anything. And my whole family isolated as well. Then my symptoms lasted about 7 days. And on the 7th day, we went into lockdown. That's when the whole country went into lockdown. And that was my last day of self-isolation and quarantine. So that was very scary. But yeah, that's how I knew I had coronavirus. I kind of knew that I had it before I even got any symptoms, just because I knew I was in contact with the patients who were positive. So I knew that it was eventually going to happen, and that I'd get symptoms. But yeah, luckily it didn't affect me that much. It affected me after more than when I actually had it. So I was really short of breath for a good few months after, to the point where I had to have chest x-ray, and I have to still carry around an inhaler with me in case I get short of breath again. Then I have to take 2 puffs of my inhaler to stop me from being breathless. But other than that, I'm okay now. So I enjoyed working in the hospital, actually. It was a very good experience for me, especially as a student, because I wasn't going to get any intensive care training. So for me, it was a very good experience. I got to see how the doctors worked as well as the nurses, but it was also very, very rewarding as well, being able to work with all these people who are responsible for looking after very, very sick patients, who were all COVID positive as well. So it was very rewarding to help to look after each patient that I did, especially when some of them made it out of intensive care unit and were able to go home as well. It makes everything worthwhile, I think. But there were days where you feel really low when you lose patients, and some of your patients die. So yeah, that's when you feel quite low and upset, but everyone around you picks you up. So that's the good thing. Everyone stuck together. Although we knew what we were doing, we were in the middle of a pandemic, we were looking after patients in ITU, we still had fun doing our jobs. We still made sure that we got all the jobs done and that we looked after ourselves as well. because it was very difficult on your mental health, you know, going into work every single day, looking after patients who are in critical care every single day. It is quite, you know, it's a bit of a burden on your mental health. So we all looked after each other when we were feeling really low, and equally we picked each other up as well. So yeah, overall rewarding, but very difficult. So personally, I think in the first lockdown, people were a lot more vigilant. They followed the rules a lot more, and people were a lot more scared, I think, in the first lockdown. Now I think people are a little bit more lenient. I don't think they're as scared. A lot of people have actually had the virus now, so they know what it involves, they know what happens with it, they know the symptoms that they get and things like that. The other thing is that I think as a clinician, during the first lockdown, patients weren't calling up their GPs, they weren't, you know, speaking to their doctors because they were scared in case the doctors asked them to come in. They were a bit scared of coming into the doctors, so appointments were really quiet. Whereas now, you know, my lists are full, the doctors' lists are full, everyone's lists are full because people are still calling in with their issues. So I think that's what changed a lot in the last year. But it has been a year, so yeah. I think the pandemic has affected me in a big way because it started when I was in my final year at uni. And I only had a few months left and everything was put to a stop. So we didn't even know if we were going to graduate that year. So it was very stressful. We still had exams, but we didn't know how or when our exams were going to take place, how we were going to be assessed. Everything had changed. The exams all went to online, but we also had one practical that always needs to be done in person because you're examining patients. So we didn't know whether that exam was going to go ahead. We didn't know what was going to happen. So obviously we were really scared, thinking that we'd been at uni for 2 years and then we're just not going to graduate this year. We'd have to wait till next year. So that's the biggest thing. I think number two, compared to other people, I was actually very lucky in getting a job. Being in healthcare, there was a big demand for people working and getting people into the hospitals, into GPs working. So it was very easy for me to get a job. So again, that affected me quite a bit, in a good way, I think. And now, in terms of working now, it's very different to how I was taught how to work, because I'm not seeing patients face to face. Whereas in the first year when I was on placement, I was constantly seeing patients. Patients would be in the waiting rooms, they'd come in for their consultations, and now it's all telephone. I have to speak to them on the telephone, triage them on the telephone, ask them about their symptoms, diagnose them and treat them. If I need to bring them in, then I do bring them in, but I have to wear full PPE. PPE was never something that we used to wear apart from things like gloves, aprons when we were doing certain procedures. Like visors and masks were never really worn. So I think that's really affected me as well, because it's really affected the way that I'm working, and it's changed the way that we all work, and I think it will continue to be like that in the future as well. I don't know what will happen in the future. I think the way in which we live has changed for a long time and will continue to change. Like, I think people are going to be more aware of their hygiene, washing their hands a lot more. I think people will still be wearing masks. And yeah, I think the way that we live has changed for a while, I think. Will coronavirus still be around? I think so. Coronavirus has always been around, but it's just this particular strain, this particular one that has caused this pandemic. And who knows, it might end up being like the flu, where we need to have yearly vaccines. No one's really sure at the moment what's going to happen in the future, whether we're going to still need booster vaccines, whether it's going to be like the flu, where we need yearly vaccines for different types of strains. We don't know what it's going to be like, but coronavirus will still definitely be around. And there will be, I think, little outbreaks that will still continue to happen around the world in the less developed countries. So like, we still see cases of Ebola, we still see cases of swine flu, we still see cases of these viruses that have been around and caused such epidemics or pandemics. So yeah, I think it will still be around, just not as bad as what it is now. I think we've learned how to deal with it very quickly in such a short space of time. So yeah.
Please stay at home, protect the NHS and save lives.